Common signs and symptoms of liver cancer. Liver cancer is a type of cancer that starts in the cells of the liver, an organ that performs many vital functions in our body, such as filtering toxins, producing bile, and storing energy. Liver cancer can be caused by various factors, such as chronic viral infections, alcohol abuse, obesity, diabetes, and exposure to certain chemicals. But how do you know if you have liver cancer? What are the signs and symptoms that you should look out for? And what are the treatment options available for this condition? These are some of the questions that we are going to answer in this video, so make sure you watch it till the end. You will learn about the early warning signs and symptoms of liver cancer, how it is diagnosed, and what are the possible ways to treat it. You will also get some tips on how to prevent liver cancer and improve your liver health. So, without further ado, let's get started. Signs and symptoms of liver cancer. One of the challenges of detecting liver cancer is that it often does not cause any noticeable symptoms until it has reached an advanced stage. This is why it is important to be aware of the possible signs and symptoms of liver cancer and consult your doctor if you experience any of them. Some of the common signs and symptoms of liver cancer are abdominal pain or swelling. Liver cancer can cause pain or discomfort in the upper right part of the abdomen, where the liver is located. The pain may be dull or sharp and may radiate to the back or shoulder. Liver cancer can also cause fluid to build up in the abdomen, leading to swelling or bloating. This condition is also called ascites. Jaundice. Jaundice is a yellowing of the skin and eyes caused by the accumulation of bilirubin, a waste product of the liver, in the blood. Jaundice can indicate that the liver is not functioning properly or that the bile ducts are blocked by a tumor. Weight loss. Liver cancer can cause unexplained weight loss due to loss of appetite, nausea, vomiting, or changes in metabolism. Weight loss can also be a sign of other conditions, such as diabetes or thyroid problems, so it is important to rule out other causes. Fatigue. Fatigue is a feeling of tiredness or weakness that does not go away with rest. Liver cancer can cause fatigue due to the liver's reduced ability to produce energy, the body's increased demand for energy, or the side effects of treatment. Fatigue can also affect your mood, concentration, and quality of life. Other symptoms. Liver cancer can also cause other symptoms, such as fever, night sweats, itching, enlarged veins on the abdomen, enlarged spleen, or changes in stool or urine color. These symptoms may vary depending on the type and stage of liver cancer, as well as the presence of other conditions. If you have any of these signs or symptoms, do not ignore them or self-medicate. Seek medical attention as soon as possible, as early diagnosis and treatment can improve your chances of survival and recovery. Diagnosis and treatment of liver cancer. To diagnose liver cancer, your doctor will ask you about your medical history, symptoms, risk factors, and family history of liver disease. Your doctor will also perform a physical examination to check for any signs of liver enlargement, tenderness, or fluid accumulation. Your doctor may also order some tests, such as blood tests, imaging tests, or biopsy, to confirm the diagnosis and determine the type, stage, and extent of liver cancer. Blood tests can measure the levels of liver enzymes, bilirubin, and alpha-fetoprotein, a tumor marker for liver cancer. Imaging tests such as ultrasound, CT scan, MRI, or PET scan can show the size, shape, and location of the tumor, as well as any spread to other organs. Biopsy is a procedure that involves taking a small sample of liver tissue and examining it under a microscope to look for cancer cells. The treatment of liver cancer depends on several factors, such as the type, stage, and location of the tumor, the function and health of the liver, the overall health and preferences of the patient, and the availability of resources. The main goals of treatment are to remove or destroy the tumor, prevent or slow down its growth or spread, and relieve the symptoms and complications. The main types of treatment for liver cancer are surgery. Surgery is the removal of the tumor and some surrounding healthy tissue to ensure that no cancer cells are left behind. Surgery can be done in two ways: partial hepatectomy, which is the removal of a part of the liver, or liver transplantation, which is the replacement of the entire liver with a healthy one from a donor. Surgery is usually done for patients with early-stage liver cancer, who have good liver function and no other serious medical conditions. Ablation therapy. Ablation therapy is the use of heat, cold, electric current, or chemicals to destroy the tumor cells. Ablation therapy can be done by inserting a needle or probe through the skin, or by using a laparoscope, a thin tube with a light and a camera, through a small incision in the abdomen. Ablation therapy is usually done for patients with small tumors, who are not eligible for surgery or transplantation. Embolization therapy. Embolization therapy is the use of substances, such as beads, coils, or drugs, to block or reduce the blood flow to the tumor, thereby depriving it of oxygen and nutrients. Embolization therapy can be done by inserting a catheter, a thin flexible tube, through a blood vessel in the groin, and guiding it to the liver. Embolization therapy can be combined with chemotherapy, which is the use of drugs to kill cancer cells, or radiotherapy, which is the use of high-energy rays to damage cancer cells. Embolization therapy is usually done for patients with large or multiple tumors, who are not candidates for surgery or ablation. Targeted therapy. Targeted therapy is the use of drugs that target specific molecules or pathways that are involved in the growth and survival of cancer cells. Targeted therapy can be taken orally or intravenously, and can be used alone or in combination with other treatments. Targeted therapy is usually done for patients with advanced or metastatic liver cancer, who have not responded to other treatments. Immunotherapy. Immunotherapy is the use of drugs that stimulate or enhance the immune system's ability to fight cancer cells. Immunotherapy can be given intravenously or subcutaneously, and can be used alone or in combination with other treatments. Immunotherapy is usually done for patients with advanced or metastatic liver cancer, who have not responded to other treatments. The choice and effectiveness of treatment may vary depending on the individual case and the response of the patient. The possible side effects and complications of treatment may include bleeding, infection, pain, liver failure, kidney damage, nausea, vomiting, diarrhea, fatigue, skin rash, or allergic reactions. Your doctor will monitor your condition and adjust your treatment accordingly. You may also need supportive care, such as pain management, nutritional support, or palliative care, to improve your quality of life and comfort. Prevention and tips for liver health. Although liver cancer is a serious and life-threatening disease, there are some ways to prevent it or reduce its risk. Here are some tips for maintaining a healthy liver and preventing liver cancer. Avoid or limit alcohol consumption. Alcohol can damage the liver cells and cause inflammation, scarring, or cirrhosis, which can increase the risk of liver cancer. If you drink alcohol, do so in moderation, which means no more than 1 drink per day for women and 2 drinks per day for men. Prevent or treat viral infections. Viral infections, such as hepatitis B or C, can cause chronic inflammation and damage to the liver, which can lead to liver cancer. You can prevent these infections by getting vaccinated, practicing safe sex, avoiding sharing needles or personal items, and getting tested and treated if you are exposed or infected. Maintain a healthy weight and diet. Obesity and diabetes can cause fatty liver disease, which can also increase the risk of liver cancer. You can maintain a healthy weight and diet by eating a balanced and varied diet, rich in fruits, vegetables, whole grains, lean proteins and healthy fats, and low in saturated fats, sugars, and salt. You can also exercise regularly, at least 30 minutes a day, 5 times a week, to burn calories and improve your metabolism. Avoid exposure to toxins. Toxins such as aflatoxins, arsenic, vinyl chloride, or thorium dioxide can contaminate the food, water, or air and cause liver damage or cancer. You can avoid exposure to these toxins by washing and cooking your food properly, drinking filtered or boiled water, wearing protective equipment, and following safety regulations at work or home. Quit smoking. Smoking can increase the risk of liver cancer, as well as other types of cancer, by introducing harmful chemicals into the body, which can damage the DNA and cause mutations. Quitting smoking can reduce the risk of liver cancer and improve your overall health and well-being. Get regular checkups. Getting regular checkups and screenings can help detect liver cancer at an early stage, when it is easier to treat and cure. You should get checked for liver cancer if you have any risk factors such as chronic liver disease, family history, or exposure to toxins. Your doctor may recommend some tests such as ultrasound, blood tests, or biopsy to check for any signs of liver cancer. These are some of the ways to prevent liver cancer and keep your liver healthy. Remember, your liver is a vital organ that performs many functions in your body, so you should take good care of it and protect it from any harm. If you have any questions or concerns about liver cancer, do not hesitate to consult your doctor or a health professional. We hope you enjoyed this video and learned something new and useful about liver cancer. Liver cancer is a serious and life-threatening disease that can affect anyone, but it can be prevented and treated if detected early and properly. In this video, we covered the common signs and symptoms of liver cancer, how it is diagnosed and treated, and what are the tips for preventing it and improving your liver health. If you liked this video, please give it a thumbs up, share it with your friends and family, and subscribe to our channel for more informative